panel that we're going to discuss. All right, first of all, let me thanks for everyone for showing up at this panel. We have three distinguished gentlemen here this evening who will be imparting some knowledge on us regarding this pandemic that is ravaging the world. We have Dr. Johnathan Henderson, Dr. O'Neill Pike, and Dr. Cleston Headley from out of Jamaica. Let me give you a brief introduction about Johnathan. Dr. Johnathan Henderson is a family physician on faculty at the Floyd Medical Center, Medicine Residency in Rome, Georgia. He serves as a clinical instructor for medical resident and is a family medicine clerkship director for medical student education. He received his undergraduate training at Oakwood University in Huntsville, Alabama, and received his Doctor of Medicine at Yale University in New Haven, Connecticut. Subsequently, he completed a fellowship at Integrative Medicine at the University of Arizona in Tucson, Arizona. He's a member of the Fellow of the American Academy of Family Physicians, the Society of Teachers in Family Medicine, and the Georgia Academy of Family Physicians, on which he sits on the Education Committee. In addition to being a faculty at Floyd, he's also an adjunct faculty at the Medical College of Georgia at Augusta University and the Moore School of Medicine. He has many teaching awards, with the most recent being the Master Preceptor Award in 2019 from the Society of Teachers in Family Medicine. Other community awards include Dorothy Irene Height Trailblazer Award in Medicine in 2015 from the National Council of Negro Women. He's married to the former Zakiba Watkins of New Jersey, who has all served as a medical officer at the Centers for Disease Control for many years, but has taken on a role as Senior VP and Deputy Chief Medical and Health Officer for the March of Dimes National Office, and currently serving as the Interim Chief Medical Officer. They have three beautiful children, three beautiful daughters, Johanna 16 years old, Kennedy 15, and Eden 10. They also have a dog, shelter dog named Benji. They got that dog during the pandemic. When Dr. Henderson is not spending time with his family, he spends time reading, cycling, and counseling the youth. Ultimately, his passion is definitely teaching and focus on integrative medicine and nutritional health in everyday life. So, gentlemen, Dr. Johnathan Henderson. Next doctor on the panel is Dr. O'Neill Pike, MD, MBA, SFHM. He's a Cornwallian and part of our class of 1986. Dr. Pike joined Jackson Health System after over a decade at Medicus Healthcare Solutions, where he was Chief Medical Officer. While there, he worked with hospital CEOs and COOs to push their vision forward and help manage their clinical growth. Prior to his time at Medicus, he founded and served as CEO for Pike Life, a successful healthcare consultant business that helped drive change and gratitude leadership at more than 250 healthcare systems, facilities, and related organizations. Additionally, Dr. Pike served as the Director of Hospital Medicine for Keystone Healthcare Management, where we helped build the company's healthcare medicine service line. He's a board-certified internal medicine. He's board-certified in internal medicine and is a diplomat of the American Board of Internal Medicine. Dr. Pike has a Bachelor's of Arts degree of Arts in Biology from Queens College City University of New York, a Doctor of Medicine from the Ohio State University College of Medicine, and an MBA with concentration in Strategic Management and Data Analytics from Villanova University in Pennsylvania. As an experienced physician with over 20 years history of working compassionately and strategically in diverse patient environments, Dr. Pike complements the already outstanding clinical team at Jackson North Medical Center. So that's That's Dr. O'Neill Pike, which is a member of our Cornwall College body, and also went out and did great things. Now, our next person on the panel is Dr. Cleston Headley. He's a clinical pharmacist. Did I get that right, Cleston? His professional objective today is to actually utilize knowledge and experience as a clinical pharmacist with an organization that is committed to upholding the highest standards of quality patient care, which affords the opportunity to handle multidisciplinary responsibilities and fosters a friendly and cooperative work environment. Now, he attended Cornwall College from 1981 to 1986. Then he went on to sixth form from 1986 to 1988. From there, he went on to CAS, or now what we call it University of Technology in Kingston, from 1991, where he got a diploma in pharmacy. In 1999 to 2000, he got a bachelor's in pharmacy with honors. And in 2010 to 2013, he's got his PharmD. Now, this man has a long work experience. He's worked at National Health Foundation, worked at Cornwall Regional. He's also a lecturer in pharmacology in the past from 2011 at the University of the West Indies. He's actually still doing that now from 2011 to now. He was an adjunct professor in pharmacology at the University of Technology. So, gentlemen, we have, he has a great achievement as our Western Regional Chief Pharmacist in from 1998 to 1999 and also 2001 to 2010. He's Pharmacist of the Year at Cornwall Regional, not once, not twice, but 3 times, 2004, 2006, and 2007. Without further ado, gentlemen and ladies, I want to present to you our panel this evening. Dr. Henderson will take on and start with his presentation, and Dr. Cleston Headley will follow up, and then follow up by Dr. O'Neill Pike. Go ahead, sir.
All right, thank you all. Thank you for having me. It's a pleasure to be here this evening whenever we get a chance to share with folks about things. It's just a privilege to be able to do that. So I'm going to start by sharing my screen. Hopefully you all should be able to see that.
Yeah.
All right. So basically we're here, as all of you know, here this evening to talk about COVID-19. I think the initial flyer that was sent out says something about the noise and all the things that's going up. The world has never seen in a very long time any pestilence like this as far as affecting the whole world. So we wanted to spend a little time this evening talking about, giving you a little background, talking about the vaccination, talking about the different other pandemics that we've had, vaccines, talking about reasons why some people may or may not choose to get the vaccine, and in the end, we want to have some questions. So I'll start out by giving a little background. Dr. Headley will come in and talk about the vaccines and as far as side effects and things of that nature. And Dr. Pike will come in at the end and talk about kind of what the clinical picture is in someone who has COVID disease and what the picture may look like for somebody who is vaccinated versus unvaccinated. So just a little background, coronavirus, COVID-19, we've been inundated with this for almost 2 years now. As most of you know, it was first identified in December 2019 in Wuhan, China. As far as what it causes something we call SARS-CoV-2 or severe acute respiratory syndrome, coronavirus 2, and it's called coronavirus 2 because we have a SARS-CoV-1 breakout that we had back in November of 2002, and that also started in China. As far as other statistics, as far as worldwide, SARS-CoV-2, there have been 219 million cases. This is from looking at the dashboard just early this morning as far as COVID-19, and there have been over 4.5 million deaths to date. And if we look at the numbers from when the pandemic first started, that gives us a case fatality rate of about 2%. Looking at SARS-CoV-1, which was back in 2002, there were only 8,000 cases, which affected about 29 countries. However, of those 8,000 cases, there were nearly 800 deaths. So the case fatality rate was nearly 10%. So if you got SARS-CoV-1, the likelihood of you dying was very high. Other pandemics to look at, the influenza pandemics that we know of, particularly H1N1, sometimes affectionately also known as swine flu or bird flu. Back in 2009, across the world, there were 700 million cases with 284,000 deaths, and that gave a case fatality rate of 0.04%. If we go back and compare that to the influenza pandemic of 1918, there were about 500 million cases, so a little less, but 50 million deaths are estimated. And you have to keep in mind that back in 1918, there were only about 2 billion people on the earth, whereas in 2009, there was 6.5 billion. So to have that many people taken out by a virus in 1918 was very significant, and it had a case fatality rate about 10%, same as the SARS-CoV-1 did. So if we look here in the United States, for those of us who are here, when first this thing came out, people were saying it was like the flu. I think most of us know now that it's nothing really like the flu. On average, we have about 30 to 40 million cases of influenza during flu season here in the United States, and about 30 to 40,000 deaths, which gives a case fatality rate of about 0.1%. But if we look at SARS-CoV-2 or COVID-19 disease, here in the US, we've had about 39.8 million cases so far, with 644,000 deaths, and our case fatality rate is about 1.6%. If we want to go into the statistics here for Jamaica, you'll see here that since the pandemic has started, there have been 69,789 cases. This data is from up to date from as of Friday. With a population in Jamaica of about 3 million, and this many cases, as far as deaths, there have been 1,585 deaths to date. Now, I put in parentheses there for you, 357 of those, of the total number, has been only within the past 28 days. So literally, about 20% of those deaths have taken place only in the last month, which is very significant. And obviously, as most of us know, that's due to this Delta variant that's scavenging the whole earth right now. And on the right, you also see you can break it down by the different parishes as far as cases and deaths. But unlike the US, where the case fatality rate is about 1.6%, there in Jamaica, it is 2.2% case fatality. So I wanted to spend a second talking about the process of vaccines right quick, because one of the arguments was, how can someone roll out a vaccine so fast? And so people were really skeptical about getting a vaccine that came out in a matter of months, as opposed to most vaccines may take up to 5 years before they come to market. So you have your preclinical testing, in which they use animals to kind of test to see how immune response a person might have. And then they do the safety trials in phase 1 and 2. And when phase 2, what they're really looking at is just only a couple of hundred people, and they're testing to see how do people respond in different groups, you know, as far as ages, elderly, as far as children, and things of that nature. And then when you get to phase 3, this is where you really get to test the vaccine and see how efficacious it is, and to look at a whole panel of side effects if you get any, because now you're looking at 20 to 30,000 people that you're enrolling here in these studies. And so the reason why in the past it took so long for vaccines to come to market is not because it was just so hard to do it, because you had to enroll people to get to those numbers. But with this particular pandemic, people lined up and volunteered. So we were able to get those numbers of 30,000 plus people to see how this vaccine works in a matter of months. So this just talks about the type of vaccines that we have. Some of the ones currently, usually in the past, you can do it in different ways when you're developing a vaccine. You can take a live vaccine and you can weaken it. and you can introduce that to stimulate the immune system. Something like that would be like the varicella or chickenpox vaccine. You can take a virus and basically kill it or make it a deadened virus and introduce that. Basically, the influenza vaccine every year is similar to that. Or you can just take a component of the vaccine and purify it and stimulate the immune system that way. And or you can use a toxin or inactivated toxin like we do with tetanus. Now, the thing that's interesting as far as the vaccines for COVID-19 is we're using messenger RNA technology to formulate a vaccine, which has never been done before. Now, the messenger RNA technology has been around since the early 2000s, but it hasn't been used to formulate a vaccine. Now, there are all other types of vaccines that are being formulated for COVID-19 as well. There are some people who are using the subunit components and activated virus and things of that nature. We're going to spend a moment or two talking about the ones that most people are concerned about, know about, and the messenger RNA vaccines and the DNA vaccine. So currently there are over 102 vaccines that are being tested worldwide, and about 33 of those are in phase 3 trials right now. The ones that most of us are familiar with, here in the US, we have the Pfizer, the Moderna, and the Johnson & Johnson vaccine. And in Jamaica, the most prominent ones are also the Pfizer, Johnson & Johnson, but also the Oxford AstraZeneca vaccine. Now, the Johnson & Johnson and the AstraZeneca vaccines are what we call adenovirus vaccines, and we'll talk about how those work. But the Pfizer and the Moderna ones, those are your messenger RNA vaccines. So here's just a schematic, cartoon schematic of the coronavirus, and you'll see that the prominent thing about the coronavirus is the spikes, the protein spikes that stick out from its surface. And what you see in the middle is that little ribbon of RNA, or the genetic code for the virus. And that little arrow part is the part that codes for that spike protein that sticks outside of the virus itself. And so most of the vaccines, or the ones that we're familiar with here in the US and in Jamaica, those vaccines are coding for that spike protein in their vaccines. So the adenoviruses, this is the way they work. Basically, adenoviruses, there are tons of adenoviruses, thousands of them. There are only about, I think, 9 of them that infect humans, though. So it has actually a DNA virus, and the adenoviruses cause colds and all types of things of that nature, so that it's easily to infect cells. And so what they've done with the adenoviruses, which is your AstraZeneca and your Johnson & Johnson vaccine, is they've taken that genetic code of the RNA that codes for that spike protein in the coronavirus, and they've joined it to the DNA virus in this adenovirus, and then they introduce it into the cell, and then that goes to your nucleus of the cell, and then it injects the DNA. Now, of note here, the DNA that is injected into the nucleus does not combine with your DNA. That's impossible for it to do. It cannot do that, so it does not change your DNA. It would need special enzymes like DNA integrase to do that, and it just doesn't have that mechanism to do that. So if you hear people talking about, changing DNA, it can't do that. And so then once its DNA is in the cell, then it codes for messenger RNA, which goes outside the cell, and then it makes that spike protein, which is introduced on the outside of the cell, and then your body will form antibodies and do an immune response to it. The mRNA vaccines, a little different. We use for the Pfizer and the Moderna vaccines a lipid coating because it easily gets into the cell that way. And then it's introduced into the cell, but it does not go into the nucleus. It stays out into the cytoplasm. And then that RNA, it codes and makes those spike proteins, as you see there. And like the adenovirus vaccine, similar thing, those are introduced outside the cell, and the body forms antibodies and does an immune response. Now, we'll say this, going back as far as the reason why we have all the variants that we have as opposed to just the wild type coronavirus that we initially had, is the coronavirus itself, when it's making and copying all the components of a virus so that it complete itself and put it out into your body, it can make mistakes in doing that. And so for every 100 base pairs that it does, it can make up to 8 to 10 mistakes doing that. Now, some of those are unstable and they disintegrate, but some of them survive. And so that's where we get all these different variants, where the ones that survive now, they're mutations when it reproduces itself. And so we have all these variants in the Delta variant that most of us know of right now. Whereas DNA is more stable than RNA. It only probably has about 3 to 4 mutations sometimes when it's reproducing itself. But the difference between RNA and DNA is the DNA has a mechanism by which to repair itself. So it doesn't make as many mistakes. So let's look at vaccinations. Vaccinations, these are just numbers, and I won't go over all of them as far as how many people are been vaccinated in the United States and fully vaccinated. We have about 53% that have been fully vaccinated. We've given out over 374 million vaccinations to date. Obviously, there are side effects, which Dr. Headley is going to talk about, so I won't go into details about those. But obviously, with anything that you have, there may be side effects or even death related to it. So the way that we kind of keep up is a self-reporting system that you can go to, at least here in this country, the Vaccine Adverse Event Reporting System, where people can put in what kind of side effects that they've had. And as far as what we can tell, there have probably been over 7,000 deaths probably directly related maybe to the vaccine. So if you take that into account of all the million doses that we've given people, at least in this country, that gives you a vaccine fatality rate of 0.0019%. So in essence, if you remember, the fatality rate of getting COVID itself and dying was much lower than that. So you have 850 times more chance of getting COVID and dying than you do from getting the vaccine. And just wanted to, as far as Jamaica is concerned, at this point, there have been over 550,000 doses that have been given. So at least that many people have had one dose. Unfortunately, as far as the people who've been fully vaccinated, only about 145,000. So it's slightly less, and it may be around 5% now of the total population of Jamaica that's been vaccinated. So here are just some reasons that I've heard. I'm sure that some of you may have heard as well about maybe why people don't like to get vaccinated. Vaccines, they say, contain aborted fetal tissue, when that's not true. And if we can go into detail about that further, someone has a question about that, talking about vaccines contain ingredients like fertilizer, that are in fertilizers, like monopotassium phosphate. Just to let you know, monopotassium phosphate is the same ingredient that's in Gatorade. And I'm sure most of us have had Gatorade and we have not passed out or died. Some people are saying, well, I just don't trust the government. I don't trust what they did at Tuskegee in this country, in the United States. Remembering that in Tuskegee, they withheld treatment. They weren't given treatment, which is a major difference. And then other folks are saying, well, now we're seeing people who've been vaccinated who are also getting sick. And most of that data comes from Israel, where they were the first country really to jump on board and start vaccinating most of their folks. But unfortunately, they've kind of tapered off and don't have as many of their total population vaccinated at this point. But what we have learned from them is that after about 6 months or so, that the vaccine does seem to lose some of the efficacy. But we do know that it still does very well against preventing death and severe disease in most people. So what I want to do here is just transfer it over into Dr. Headley, and I'm going to unshare my screen, and then he'll talk to us about some of the side effects of the vaccine.
All right, thanks, Johnathan. All right, so very good, Johnathan. So here we are. A lot of persons concerned about the side effects of these COVID vaccines, right? But there's no perhaps real fear, right, to talk about, right? Some of the things that may have, discussed, but Johnathan has discussed. But what's happening here? All right. So if I take a break and ask the gentlemen, what happened on September 7, 1981? Anybody can tell? The first male in the group? Ricky, Kirk,
No
Garth?
idea. No idea. No idea.
No idea? That's the
No.
first day at school at Cornwall. Monday, September 7, 1981.
All right, you got us. You got us there. You got us.
That's the day we started Cornwall. All right. So
God,
here it
God,
is.
God was late. God was late.
Huh? Oh, God
God
was
was
it.
late.
Okay. All right, fine, fine. But the majority of us had to on that date anyway. All right.
Yeah.
Of course, these COVID vaccines, as Jonathan mentioned just now, it's very effective, right? Um, but the one thing that we know of now, as he mentioned with the Israelis, that the vaccines do not guarantee complete protection from the disease. So there are persons who are vaccinated who will actually get the disease, but the important thing to note is that they won't get as sick as those persons who are not vaccinated, right? And of course, we note that there must be adjuvants, so there are things that are added to these vaccines to make them viable, right? We call those adjuvants, right? Since this is a drug. And, a lot of persons have concerns about, as Jonathan mentioned just now, about the phosphate, right? There's nothing to worry about these, because of course, when look at the list, I printed a list of all the vaccines that have been made available since we started having vaccines. And of course, it's the same adjuvants that have been added to all of these. So we don't have to fear. So the BCG that we took when we were babes, right? The DPT, the mumps rubella vaccine, all of those contain the same adjuvant. So there's nothing to worry about. And all of us are still alive since then, right? We have lost a couple members, and since then, but I'm sure it's not due to any of the vaccines. Now, one of the slides that Jonathan mentioned, right, just now is the development of the vaccine. So here at the top of this table, we have the traditional development timeline, right? And this is where it is. The preclinical usually takes about 2 years, right? And year 3 is phase 1, year 4 and 5 is phase 2. Phase 3 usually takes place year 6 to year 8, right? And then we have the infrastructure put in place, manufacturing, approval, distribution, and then phase 4, which is the follow-up stage, gathering information about the product, right? That's normally what takes place. But because of the nature of this pandemic, right, we've had to do an accelerated vaccine timeline, right, where literally everything is taking place at the same time. So we see preclinical, phase 1, phase 2, infrastructure, manufacturing, approval, and distribution taking place literally at the same time in a matter of 3 years, right? And then phase 4 is what we now use as follow-up. So
Hey, question.
yes.
Can you put that in slideshow mode? Is it possible?
Oh,
Yeah.
okay, great.
Yeah. So we could see you on the slide. Yeah.
Yes,
All
thank you,
right,
sir.
great.
Dr.
You're seeing it
Henderson.
now? Okay, sorry about that. All right, so here it is that we're currently in, for this accelerated timeline, we're now in the phase 4 stage, right? Both distribution and phase 4 stage, where we're looking at all the side effects and so on, right? So some of the side effects that are associated with these vaccines, right? We talk about fever, fatigue. There are lots of persons who say when they take the vaccine, they sleep. That happened to me. So I slept, and I slept peacefully for that entire night, right? Didn't wake up until next morning, probably about 8 o'clock, right? There's headache, there's muscle pain, right? So just where the injection is placed, there's usually pain, right? Not for long, but nothing to worry about. There may be chills as well. Some persons report diarrhea and or constipation, right? And so on, right? But it should be noted that these side effects are transient and they don't last very long. So there's no need to worry, all right? Now, of course, there are other effects. So, for example, based on the immunity that is generated, right? So, if the person produces, well, there are some substances. I don't know if I, probably mentioned them. So, there's some immunoglobulins, right? Like IgE, IgA, and so on, right, that are produced. So for those persons who produce um, the IgM, right, they'll get the severe allergic reactions, right? Not everybody does produce that, so they're not going to get those allergic reactions. All right. And of course, we continue to assess the risk of those allergic reactions. So if those persons who have been vaccinated were told to sit down for 15 minutes for observation purposes, right? If they actually develop the allergies, then they're observed continuously, right? And so they're asked to note any changes, any reactions that they may have, and report them to their healthcare providers, right? Now, there was one person who asked, or a couple of persons who asked if they should take blood thinners for a few days after the vaccine, and the answer is no. There's no need to take blood thinners, right? There has been a notion passing around that the vaccines do cause clotting, right? But there's nothing to worry about, right? Because COVID itself, the virus itself produces blood clots that is cannot be compared to anything else, right? So some of the severe adverse effects or side effects that have been noted, right? So we talk about myocarditis and pericarditis. And myocarditis is the inflammation of heart muscle, and pericarditis is the inflammation of the membrane that surrounds the heart, right? But they found that these conditions only occur in younger folks. So persons of our age don't get it. So we have, for example, the incidences of these adverse effects occurring at a greater incidence in young males compared to younger females, right? So that in younger males, it's a rate of 4.6 per 1 million persons, and in younger females, it is 2.6 per 1 million females, right? Of course, we recognize that this myocarditis and pericarditis can be caused by many factors, including infections, viruses, medicines, and environmental factors. So one of the infections that is common, and especially in males, we need to be careful, right? The sore throat that comes from a strep throat, right? Streptococcus, right? Will cause or can cause myocarditis and pericarditis. So we need to be careful. And ladies especially too, right? Once you get that sore throat, get it over within a few hours. Do all the things that you can do to get it over. All right. So we also noticed too that some severe adverse effects, including low platelet counts, right? And these may have occurred between 3 and 30 days, right? So if those don't occur within that time period, then it wouldn't be due to the COVID vaccines, all right? Now, others include blurred vision, chest pain, abdominal pain, right? You may have leg swelling, unusual skin bruising. And of course, I know of one person, one of my colleagues that works in the pharmacy who got Bell's palsy, but has now recovered totally, right? Was for perhaps about 2.5 to 3 weeks, and it resolved after the 3 weeks, right? And of course, we should mention too, because that's also a concern, that it has no effect on fertility. All right. So one of the things that we have seen is that persons who have been pregnant and have given birth to children, they recognize that the baby has now been protected from the virus itself, right? Because it passes through maternal blood into the fetus before birth, right? And one of the things for males we need to point out that persons who, and it has been, these are all the notices that have been put in, right? That it has so far not affected fertility in males, but what should be noted is that men complained of pain. There is no pain in the males who are vaccinated, but those who have got COVID, the COVID virus, or infected with the COVID, have complained severely of pain in the scrotal sac, right, and so on, right? But so far, there's no pain reported in persons who have been vaccinated, right, unless they have not passed on that information, right? So here it is that we need to know the people who should not be or should be excluded from receiving COVID-19 vaccines are those persons who have severe allergic reactions to any of the ingredients in the vaccine itself, or persons who are currently experiencing symptoms of COVID-19. All right. So we know, all right, because one of the incidences that we know is that of Michael Sharp. He got COVID, right, or was infected with the COVID when he got the vaccine, and that is what is theorized as causing his death. Right. So we actively recommend that persons who are diagnosed with COVID should not get the vaccine, but they wait until everything has been cleared so that they can get the vaccine later on. Right. But as we wrap up here, a light moment. Two atoms are playing together when one tells the other, I lost an electron. The second atom asks, are you sure? The first atom replies, I'm positive. And of course, we talk about the healthy behaviors that we need to practice as gentlemen and ladies, right? Recognize that there are a few ladies in the group, right? So we don't recommend smoking at all, right? Of course, you must partake of a healthy diet, manage your weight as best as possible to be in the healthy range. You don't want to be overweight because those are the persons who, when they get COVID, are greatly affected. You need to exercise regularly, right? If you drink alcohol, do so in moderation or none at all. And of course, get adequate sleep. And of course, we talk about greater than 7 hours. And at this point, I should point out that for this adequate sleep that we're talking about here, we mentioned that the body repairs itself between the hours of 10 and 2 a.m. That's when the body's systems work at its peak to get us recovered. So that sleep that you get, that should be 7 hours, should include the hours between 10 p.m. and 2 a.m. All right. And of course, we note, this is perhaps the last slide of the presentation. All right. Here it is that if together, all right, practicing all the protocols that needs to be, the social distancing, the hand washing, and all that stuff, the mask wearing, we will get through this together. All right. And that's absolutely very important. If we all do what we need to do, then we will get over this pandemic as soon as possible. All right. And I want to leave that quote from Jeremiah 12, verse 5, because of course we understand it's going to get worse. This is just smoke that we're seeing. If thou hast run with the footmen and they have wearied thee, then how canst thou contend with horses or the horsemen? And if in the land of peace, wherein thou trustest, they weary thee, then how wilt thou do in the swelling of the Jordan? When it gets worse than this, because of course, I have a belief, right, that vaccines were created in the lab. They have not fallen on fallen in the tree of microorganisms at all, none at all, right? So I believe, that's my belief, right? I'm not pushing that belief on anybody, but we ought to know that it's gonna get worse than this, right? Johnathan pointed out SARS-CoV-1 in 2002, and then SARS-CoV-2 in 2019, and we're gonna get worse than this. And we've had several vaccines since then, but guess what? Hang in there, and we will get through it together. All right. Thank you, gentlemen, for listening.
All right, thank you, Dr. Headley. We'll have Dr. Neil Pike. He will present next. Dr. Pike, you ready?
I am. So, Cleston, I must admit, there was some fear and trepidation even through my body, listening to all the possible side effects. So I'm going to actually spend some time to just actually talk about the clinical realities that we've seen in the hospital. And that's been there, whether you're in Jamaica or you're in the US or elsewhere in the world. So overall, the vaccine, one of the things about vaccinations, there's never been an overpromise about vaccinations. There's at no time in our lifetimes, whether we're lining up at Cornwall or elsewhere, was there a knowledge of what was really inside the vaccine. And over the last, probably I think, couple decades, a few things happened. And I think it's very important for us to understand what happened. There's been more information out there that talks about how we doubt the clinical evidence that we have. And folks are actually, having more information, but this is a key. I think a lot of people are having information that's not truly accurate. So if I am coming there and asking for advice from an electrician, and the electrician is asking me, is telling me and explain to me in detail, actually, no offense to Dr. Headley, but in that kind of detail with regards to what's going on, and I don't have the foundational knowledge to understand it, I won't. And I'll be very confused. What I want to let you know is that one of the things that we have lost is some trust in the medical community. Some of it is because of us in the medical community, but others is actually based on the realities of today, where we have a social media scenario, we have a internet that kind of puts us down rabbit holes. So there's a reason, for example, why if you go on and you ever actually search for shoes, you start getting some advertisements about socks, because they track and they actually send you based on your search down different articles. So some people, patients of mine, talk about, but I read this article and I read a lot of articles about X, Y, and Z about this particular problem. And the part of that they don't understand is it's based on an algorithm, right? It's based on an algorithm that sends you down a rabbit hole based on what you've already read. And so it's not necessarily that this is peer-reviewed journal and that is actually you're being pointed to. It's based on your direct search. There is legitimate concern here where folks have to be, I talk to my patients and I tell them, I do understand people who are concerned about this. Part of the problem is that folks are saying, okay, this vaccine came about too quickly. Now, quickly is a very relative term, right? Because we actually have been working on this for years, for decades, in fact. And so we are now finding out about it, but it's not because it's actually a new thing. It's because the mRNA and other foundational elements were there in place, and we're able to actually utilize this because we had such a large number of people to actually test this thing on to begin with. And so it's not new to the medical community. Here in the US, we hear people talking about Dr. Fauci and how he's this and he's that. Dr. Fauci wrote the textbook that we actually used in medical school. I was even surprised the guy was still alive. So this is one of the foundational guys who was, as an immunologist and an infectious diseases doctor, has actually been really at the forefront of a lot of infectious diseases going back all the way to HIV and AIDS and back in the 80s. So a lot of this is not new to us, but let me bring it to you in the sense that you can truly understand. From what I know of this, I got myself vaccinated. I got my family, my kids who are teenage daughters vaccinated, my parents who are in their 70s, almost 80s, vaccinated. All of my family members, my other siblings who are physicians themselves, got vaccinated. We did not do that on a whim. We did that because we actually read the information and we saw that this was legit. So I'll leave that aside. The actual symptoms, though, and the actual things that we see with regards to patients with COVID-19 is so different, so profoundly different than we have ever seen with influenza or any other viral infection. So for full disclosure, I'm a critical care medicine doctor. I work in intensive care unit. I actually worked on COVID-19 patients for the last year plus up until about March when I went to a more administrative role. Another side of my story coming into this presentation is that I also had COVID-19. And as a healthy person who's 50, almost 1 year old, never had any ailments like this in my life. Last year, August, September, went to a meeting in California, got COVID, came home 4 days later. I passed out in my house twice, injured myself, had to be taken to the hospital. This is not one of those things. I've had the flu. I was a sickly child. I was one of those kids who used to wear Merino to Cornwall on a hot sunny day. So I was not a child who was not sick, all right? I was always a sickly child. This was one of those things though, that was different. I lost 20 pounds and on my frame, I couldn't even stand to lose 20 pounds because of this sickness. I was out of work for 6 weeks and legitimately knew that I almost died. I've had colleagues of mine die. I've had friends of mine die. So when I hear people have vaccine hesitancy, yes, absolutely. Be very mindful of anything you put in your body. But bear in mind this, every single day you put things in your body that you don't know the ingredients of. This is one of those things that are absolutely tested, tried and true. It just happened in a very rapid fashion because we had a lot of foundational information in it before we got to this point. And the fact that you don't know it, find somebody who you trust and talk to them. But don't listen to folks who are actually just filling your head with all the possibilities of what could go wrong. This is what we do know. Right now, in Jamaica and in the United States, we have a pandemic of the unvaccinated. But this is the other part that is really distressing to us who have been vaccinated, right? And our families. We are now seeing, and we know that folks who are vaccinated early on, the vaccine, the antibodies that you build does actually go down over time. And when it goes down, then your protection from COVID-19 and all the variants that come along is less. And so what we're seeing now is that we have unvaccinated folks getting COVID and in turn infecting folks who have been vaccinated. And some of those patients are having untoward events. They're having a difficult time. And so that's why you see it's actually spreading beyond again. So right now we have another surge. And I do know, however, even from Dr. Henderson's presentation, wonderful presentation, Dr. Henderson, wonderful, is that we do see an uptick in vaccination rates in Jamaica and also here in the US, because people are actually seeing for themselves. We are at people in my hospital, and right here, I'm in Miami. We have a large health system, and the largest health system, in fact, down here in Miami-Dade. We have in our system, essentially 95% of the patients are unvaccinated, and they're filling our ICUs. Now, fortunately, we have had just a slight decline in the numbers over the last week, but we literally had a worst case scenario this year in our hospital system and our healthcare system than we did even last year about the same time. And so I'm going to pause there, and because I want to make sure we have time for questions, but I wanted to actually share that with you on a personal level, that you know, understand the fear, understand the mistrust, but this is not one of those times when you actually listen to the folks and actually make a decision out of fear. You want to make it out of facts and the information that's actually presented to you. And I guarantee you this, I will not be here as a colleague of yours, old colleague Cornwallian, convincing you to go down any rabbit hole and thinking take something that I didn't myself stand up and take. And by the way, one more thing to Dr. Headley's presentation. When I got the vaccination, I did have a fever. I had a fever, so I got COVID in August, September. I was sick until October. End of December, I got the vaccination, the first dose, and I did have a fever. I had a fever up about 100.4, 100.5, and I was actually concerned. I'm like, oh my God, did I do the wrong thing? Well, when I had COVID, you picture this. I had a fever of 103.5 for 10 consecutive days, and I was being cared for by my own sister and my own brother and mother. And nothing we did, and even myself as a critical care medicine doctor, nothing we did could break that fever. I was delusional. No, none of that happened with the vaccine. I had a mild fever, and for the most part, you will never actually, folks on this, please, you can speak up in a minute to say, we did not have those kind of symptoms. And even my own mother, who was 75 years old, she had a vaccine, nothing. No, my father, his description is that I just have a weaker constitution than my mother, which is probably true. But legitimately, most people have no symptoms whatsoever. And so that's my encouragement to you. You know, that make sure you actually arm yourself like any other decision you'd make in your life with the facts and not the fiction and the actual fears that surround this thing. Because I'm saying it also from a very self-serving perspective, just to be clear, because I want to actually get back to the normal way of life. I want my parents and my siblings and my children to be protected from this. And I also know that the more people who are unvaccinated, who actually continue to be unvaccinated, allows this virus to linger, to actually change, to morph into new variants. And each variant, this is one that happens with any virus. If you give it time to jump from one person to the next, every time it jumps, it actually gets to be more virulent. That's just the nature of it, because a virus, its intent, just like all of us, is to survive. However, it needs a host. And the people who are vaccinated do not have the viral load, the amount of virus in them, as compared to the people who are unvaccinated. It's a big, big difference. So even spreading the virus, people who are unvaccinated will have a higher viral load and spread it more. So I'll pause there. I want to make sure I give some time for questions.
All right, thank you, gentlemen. For this question and answer section, we're going to ask you kind of just raise your hands, and then we'll unmute you, and then you'll ask your question. So we have three doctors here. We have Dr. Johnathan Henderson, Dr. Creston Headley, and of course, you just listened to Dr. Neil Pike. Anybody with questions?
Yeah, there's Sammy G with a question. You wanna
All right, go ahead.
Unmute Sammy G so we can hear what he's saying, what his question is. Go ahead, Sammy. Go ahead, God. Unmute Sammy. God.
Okay, got it. I'm sorry.
Yeah, welcome, Mr. Samuels.
Love the information. Mr. Headley, Mr. Henderson, and the last speaker, I forgot your name. Love it. I love it. I love
O'Neill Pike. Dr.
Mr. Pike. All right, Mr. Dr. Pike. My question is, yes, I understand that you guys study Western medicine. What are your thoughts, right? What are your thoughts on the holistic approach with the COVID virus?
So Samaji, I'll take that one real quickly.
Good question.
Eastern medicine has always been a cornerstone and a foundation for even Western medicine. That's the first thing, all right? And I think that the holistic approach in looking at this, absolutely, all these things are adjunctive kind of treatments. So when we're treating COVID-19, one of the things that we recognize is that most of us, even folks living in Jamaica, is vitamin D deficient. That's just different. You know, we are deficient in a lot of the other vitamins, but vitamin D is actually an important one because it actually affects our immune system in a very direct manner. The other things, you know, the teas and all these things, making sure you're hydrated, all these things are actually very, very important. But at the end of the day, I'll say this one thing to you though. The treatments that we have had absolutely, unequivocally pale in comparison to the vaccination that we absolutely have here too. So even though the treatments, and we're more successful now today than a year ago, you know, more patients are actually leaving the hospital alive here in the United States at least. But no, the vaccine is a primary means to actually hold back this kind of scenario. I think Mr. Sami has a follow-up question, and then Abigail Allen likewise has a question.
All right, go ahead, Abigail.
Abigail.
I think she's still muted.
Hi, good afternoon, or good evening, rather.
Good evening, Abigail.
Okay, my question was with regards to post-infection, I think having gotten the COVID-19 infection, we were previously told that you should wait 3 months to be vaccinated. I think Dr. Headley said that, you just wait until the infection clears. And I think in the Ministry of Health and Wellness webinar today, I'm being told that they say you wait until you're well. However, is this coming from a CDC recommendation, a WHO recommendation, or is it just clinical experience? Because I'm recovering, but I'm wary, especially of what has happened with Michael Sharp, and I think another person was in the news of getting vaccinated, even though I'm clinically well.
That's a great question. I'm not sure if Dr. Headley wants. I'll say this. I would recommend a little bit longer, Abigail, to actually take the vaccine. In all honesty, so I do recognize that some of the conflicting kind of news with regards to when to take it, but I would actually recommend a little bit longer. I waited 3 months. That was the actual recommendation 90 days back then. We have actually narrowed that a little bit to say that you can get it before that time period, and that when you are absolutely clinically well, that you should actually take it. So if you just wait, I think a couple of weeks beyond when you're actually ill with this is probably going to be a wise choice, the most prudent choice, I would say.
Okay, I see Dr. Headley nodding his head.
Dr. Headley, do you agree with that?
He agrees with that.
Excellent.
Oh yeah, I was just going to say the other information that you might have heard as far as the 3-month time frame. There are some individuals who got antibody therapy or other treatments through the IV. And so if they got those types of therapies, then you still had that in your system. And so if you wouldn't respond as well to getting a vaccine as early as usually 3 months if you had one of those treatments. So that's where part of that comes from when we look at 90 days and 3 months for individuals who may have had those types of therapies for their disease.
Right. So what Dr. Henderson is talking about is a monoclonal antibody treatment that we have been using successfully for certain folks who have had COVID-19. So you'd have to definitely wait for a while beyond that to get the vaccine because your body would not respond to the actual vaccine if you had the monoclonal antibody test.
All right. We have V&W with a question.
Good evening. I just been vaccinated. I was very hesitant of taking it. My question is, now they're talking about doing the boosters. Do we really have to take the boosters, or what do you suggest? Because I'm hesitant about doing that for sure, not taking the booster.
So Veen, again, the COVID-19 vaccine is similar to other vaccinations that you've probably had. So in most hospitals, they recommend the yearly flu vaccine. We've always known that a vaccine such as this will not actually last forever. So there's some vaccines that actually last for years, if not a lifetime, if you will. This is not one of those things. And one of the things that we have talked about, I think Dr. Headley and Dr. Henderson spoke eloquently about, is we get a lot of information from the Israeli study and other studies that have been done recently. And we recognize that the antibody response and the protective nature of the vaccine does actually wane over time. And we're seeing about 6 months on the lower side, but certainly maybe about 8 months, it actually lowers. So the protection is not there as much. And so even though we've called it a booster, it's not really a booster as much as you need some extra here, just like you would have, getting the flu vaccine in the fall and having to get it again the following year. Primarily because the flu is not as dominant an illness in the summertime, but you do need it in the wintertime, especially here in the more temperate climate of the United States. Dr. Henderson?
Yeah, I totally agree. Nothing to add.
We have a question in the chat. How was the Bell's palsy resolved with the person who had this adverse vaccine reaction? was medication
All right.
given or hospital treatment?
All right. So for that individual, we just had a series, a dose of prednisone to decrease the inflammation that was produced for the Bell's palsy, and the result after 3 weeks. So we're quite fine. The person's facial features are back to normal. So you would not know, if you did not know that they got it, you would know, looking at the person now, you would not know that they had it.
Bell's palsy. Okay. All right.
All
We
right.
see
Bell's palsy is something that twists the face like somebody who has a stroke.
a stroke. Yes, yes.
Right?
Mr.
All right,
Ricky
Sammy G.
Perkins, you have a question?
Okay,
You
great.
wanna
Thank you.
God, you wanna unmute Ricky Perkins? So can
I'll get it.
Ricky
Right.
try to unmute yourself? Okay, there you go.
Yeah, okay.
Ricky, hold
Dr.
on.
Pike.
Sammy G was here first.
Okay.
Yeah.
Yes, I'm sorry.
Go ahead, Sammy.
Right
Your
after
turn.
me. My question is just comparing previous vaccines. I'm referring to the effectiveness. I mean, we hear about the Moderna and the Pfizer being 95 plus, the Johnson and Johnson being 70 plus, correct me if I'm wrong. But comparing past vaccines, the polio, the blah, 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 what are the average effectiveness of vaccine? Because folks are under the assumption that vaccine is supposed to be 100%. This is mRNA. It's got to be extremely effective. I just want to know if you guys could compare the effectiveness of past vaccine with these current. And should we expect more out of modern vaccines than past vaccines? If you can elaborate a little, if you guys know those numbers.
I can talk about that a little bit as well. Vaccines in general, and I think one of the other doctors that mentioned this, the intent is never to prevent a disease 100%. None of them can do that. And neither was it the intent. Even when this pandemic started, the initial conversation was, which got lost after a while, was not to cure things per se, but to keep people from dying and having severe disease. And that's what most all your other vaccines do. Most of your other vaccines do not have as high of an efficacy rate, but as you see, is the more and more people that get them, then we don't see as much of those disease running rampant. Of course, we may get occasional epidemics of outbreak of disease and folks who may have pockets where they may not be vaccinated. One of the other vaccines that actually has a pretty high rate of efficacy is the measles component that's in the MMR vaccine, the measles, mumps, rubella. It pretty much after a second dose approaches 98, 99% as far as keeping people from getting the disease or severe disease. But most of the other ones aren't that great. But like I said, the intent is not that some people won't have breakthroughs and get them, but you don't want people to die and to be very sick.
Ricky,
And real
thanks,
quickly on that, just to give Sammy G one more on that, is that so the yearly flu vaccine that we get, for the most part, is at best like in the low 60s in its efficacy. And this is actually a true breakthrough on some level in modern day viral type vaccines to have that level of efficacy at the 95+%. All right. Thanks for the question.
Hi,
go ahead,
good
Ricky.
evening. Dr. Henderson, Dr. Pike, and Dr. Headley. I do believe that if information presented today was just fantastic, you guys should go on YouTube and do a channel, because I think the greatest battle that you have right now is on YouTube and social media, and such false magnets on your body and light bulbs. And I believe that it needs to be countered, because this information presented today was fantastic. I mean, it's easy to listen to and you learn from it. And I really appreciate it. Yeah. So my question, right, in terms of the peak of Delta virus in Jamaica, where do you think we are along the way in terms of the peak with Delta virus?
Yeah, that's you know, the Delta variant has definitely been the dominant one right now, and unfortunately, it's more virulent, and that's unfortunate, right? But that's somewhat par for the course, expected. Um, Really hopeful that at some point here that we'll actually see it. We're seeing more infections, and I'll relinquish the floor to Dr. Headley, who is there in Jamaica. I'm here in Miami. But we know that there's going to be a peak, and it's going to come down, and it's going to come down mostly associated with the vaccine rate, because that's going to actually stem the tide. And you know, Ricky, great to see you, my friend. It's been what, 35 plus years. Good to see you, man.
Just adding, Dr. Pike, to the previous question, before I answer Ricky's question, the one that was asked by Sammy G. Just adding to the whole thing is that looking at the types of what makes up the vaccines. So, for example, Dr. Johnathan would have pointed out earlier that what makes up the vaccines is live attenuated, or is the inactivated portion of. So we look at this particular vaccine and recognize that they're using only the spike protein, right? That's on the outside of the vaccine itself. And that perhaps may be what results in the difference in the coverage. For example, the Johnson & Johnson and the Pfizer and so on. Right? That's my thought on that. Right? For Ricky's question, right? We look at it. The Delta is really getting to a peak now, as we see the numbers happening. But then we have to be careful, because of course, just this week, or last week really, we saw the discovery of a new variant, Mu, which is perhaps not in Jamaica yet, but it's gonna get here sometime. We know it's widespread in the US, but we have to be careful. Just get vaccinated.
Wow. With that said, gentlemen, Dr. Pike, Dr. Henderson, and Dr. Headley, on behalf of this Cornwall College 86 group, I want to say thank you from the bottom of our hearts to actually accept our invitation to come in and actually make this panel and this presentation to us. We really appreciate your expertise and your willing to answer these questions. With that said, I'm not sure if we have any more questions. We are over our limit. We're at 8. We're supposed to end at 8 o'clock. It's now 8:07 or 7:07 Jamaican time. Any more questions?
Go ahead. I was looking for Andre. Usually he has a lot of questions in the WhatsApp group, so I was looking for him to see if he has any questions right now. Andre, I have to call him out. He's my brother like that. Yeah. Any questions, Andre?
Yeah, Andre, you can unmute. Go ahead and unmute your mic, Andre.
Yes, hello.
Hi, Andre. Yes, we're hearing you.
Oh, no, I don't really have any questions, I'm good.
Okay, please remember, I'm the administrator in the WhatsApp group also. So all the questions need to be asked here.
All right, so before we go, we have Sammy G and Julian Foster again looking to ask questions. So let's get these 2 quick questions, and then we could actually close out.
Okay.
Go ahead, Sammy G.
All righty. I'm sorry, guys. You guys got to forgive my questions, all right? I'm always learning, and I love knowledge. Part of the negativity that's being spread, right, that's making things difficult for you folks is, let me not even mention names, but they were speaking so much about this is going to affect us, this is part of this. But my main question is pertaining the development and the research of that mRNA, right? Preparing for this new germ warfare. As doctors, do you guys have any information about germ warfare and the fact that the ability to produce vaccines can be expedited this quickly? I mean, I don't know if I'm phrasing the question right, but what have you guys heard about germ warfare to the point where we have to look that we might have to just be living like this You know what I mean? Getting vaccines to cure things or to help stop things from affecting us, if that's a valid question.
No,
All
all
right.
questions
If I
are
jump,
valid, Sammy.
Mhm.
And to be honest with you, you know, maybe the germ warfare is kind of beyond the scope of this particular conversation because that's a bigger topic, right? But we've been battling very challenging organisms in a hospital for a long time. And so we have bacterial organisms that we challenge us because, and the challenge that we have is, for example, the medications that we have to treat those particular type of you know, organisms are kind of not as good as it used to be because, again, all these organisms kind of change, and as they morph, sometimes we are not actually quick enough to keep up with it. So some of the antibiotics we have don't actually treat certain of the bacteria even and other organisms that it used to, because that's just the nature of things. From a vaccine standpoint, the vaccine used now in this case for a pandemic is a very unique thing, right? The last time this world has actually seen anything similar to this was back in 1918, well before our time. Well, maybe except for Garth was around. But you know, we actually legitimately, this is a once in a lifetime kind of scenario. And that's why when people talk about we are all in this together, it is so true because there's no way when you get out of a pandemic, the world is so interconnected that, you know, just getting on a flight and, you know, we are so interconnected with commerce and socialization and the like, there's no way to actually not be all in this together because as we actually solve it in one area, someone travels to the area and there we go again. And so that's why that's so important for the vaccine. The vaccine in this context is such an important piece.
All right. If I jump in here, Dr. Pike, I'm not sure how many persons there, and I don't want to be controversial, but just on the weekend I heard about CRISPR technology and VMAT2, right? And that document that was leaked from the Pentagon in 2005. I'm talking the Islamists in the Eastern region, right? And this is what is being worked on right now. It's all on Google. People can
So
look at
Cleston,
it,
just to kind
right,
of break in
in
for a
more
second,
details.
Cleston.
But all of these CRISPR, CRISPR,
So
right?
Cleston, the one thing I would fear a
Yeah,
little
man,
bit
go ahead.
sometimes is that you know, like CRISPR technology is a brilliant technology, which is actually ultimately, hopefully, going to work to actually cure diseases. Now, anything that we use with regards to virus or such can always be used in a nefarious fashion. And yes, that's a concern. But to be brutally honest, it might be a little bit beyond the scope of such a conversation because just to stay just focused on this
Right.
task at hand, which is
Okay.
control this, because
Right.
that kind
What
of
is at
stuff
hand?
is
Yes.
that kind of technology is so beyond the scope of most, even physicians, let alone lay people, you know? So, because that's a very, very important technology. But even myself, as I sit here as a scientist, it's hard to actually understand and wrap your brain around the whole CRISPR and other things. So,
All right, Jillian, we have wanted to ask a question. Let me know if you still want to do it. Jillian Forrest, we'll unmute you.
Yes. Can you hear me?
Yeah, we hear you.
Okay, wonderful. So quick question, very quick question. In terms of the virus, if you've tested positive for the virus, how long does it stay in your system in terms of if you retest like a month or two later, will you still show positive? How does that work in terms of the virus in your system and you know, how long it's detected?
so
All right.
Dr. Henderson, if you
Yes. There's with all of these viruses, well, what has been noticed with viruses is that once you get them, they stay in the body for the rest of your life, right? So we see that with quite a few viruses, the herpes virus and, you know, the HIV virus and so on, right? So one of the things that we do is that once your body produces enough antibodies, it reduces the viral load so you don't get actually sick from it, right? So that's a challenge, right? So it is low enough after, as Dr. Pike said earlier, 3 months, so one can get the vaccine.
Right. But so are you saying then that you will always show a positive if you've had the COVID virus?
No, no,
Okay.
no.
But I think
no.
you're talking about, so she's talking about testing of maybe retesting after someone's had the infection. And I've seen various things with different people. Usually, obviously, once you've gotten over the virus, and like you were saying, your viral load is much lower. Usually within, for most people, probably once they're over that period and they're feeling well and they retest, then you may not find evidence of it when you retest. However, particularly with the PCR technology that we're using and when we're testing to see if the virus is present, remember that if any component of that virus is still there, even if you're not quote unquote infectious, sometimes they can still pick up parts of the virus from that PCR test. So we've seen people who've been positive, but they're not infectious. So in that particular case, obviously you need kind of the physician or a clinical person to help you through that, so to help you understand whether or not you're infectious or not and what may be going on.
Right.
Okay. Thank you.
Welcome.
Any more questions? Have any more?
Doesn't seem that way, Turbo.
Yeah, we're going to thank our sponsor, medoraware.com. And again, thank the panel and for the participants, the folks who actually showed up and actually made this possible. We appreciate you coming out, and hopefully we'll do this again some other time. Without further ado, I want to say thank you, Godspeed, good night. Be safe out there.
Yeah, thank you, Turbo. Thank you, Andy. All 86ers, if you could just stay online a little bit. Ladies and gentlemen, usually we have a party on this platform, you know, so you can stay and enjoy the music that we're going to be playing. You're all welcome to enjoy the music, all right? Dr. Pike, Dr. Henderson, Dr. Headley, thank you all for coming out. Medora Weir, thank you.
Thank you.
Okay.
Long time, years. You good?
Andy, I think Turbo, I think we're having people coming on now thinking that this thing is starting at 7 o'clock.
Well, you got to inform them that it's over.
Oh wow! So
yeah, because I noticed person coming on now.
Well, just send them a link to the live. I mean, to the rebroadcast, so they actually could see it.
Yeah, hold on. Let me.